Improvement and development of the healthcare sector in the northeast region remains the major concern. In yet another move by the centre, a project named Swasth Uttar Purv or Healthy Northeast has been launched by the Ministry of Development of Northeastern region in the capital. We bring you a report. Aiming to bring about change in the healthcare scenario and to bridge the gap of the northeastern region in health transformation, as well as to enhance capacity building, an important project has been initiated by the Public Health Foundation of India, supported by the Ministry of DoNER. Despite the region being the most vibrant in the country, it lags behind in key health indicators. Negligence, lack of awareness of health issues and lack of infrastructure and manpower has shrunk the overall development of the region. The momentous ceremony was attended by a host of dignitaries as well as people from all walks of life who witnessed the launch of the much-needed health project.
The Ministry of the Development for Northeastern region has provided funding to the Public Health Foundation of India to launch a major program for public health strengthening in the Northeastern region. We do recognize, however, that the Northeastern region is an area which requires a great deal of support in strengthening health in all of its dimensions, both through health system strengthening as well as through community empowerment.
The initiative will help catalyze a trained workforce by imparting appropriate training in delivering healthcare. This project aims at building broad-based capacity within the health services, civil society, general public and school system as well as within the media in order to deliver a variety of services ranging from both technology-enabled health services as well as health information which can be transformational in terms of empowering people.
We are working, today working with PHFI for building capacities. We also intend to work with other organizations like VHAI to see on school education. Is it possible to have modules in the school education? We also want to work with youth clubs and the NSS teams so that they can, in their terms, they can go around. So it is a multi-pronged thing.
Under the initiative, PHFI and DoNER will provide technical assistance to the state governments of Northeast and civil society partners for implementation of public health projects and programs in the region.
Well, the Northeast is a very enlightened region where people are very culturally advanced, quite literate. Unfortunately, the health indices are not very good indeed. And they're lagging behind many other areas of social and cultural and even economic development. And this is partly because of lack of access to services, but also because of lack of adequate managerial capacity within the health system for design and delivery of services as appropriate to the Northeast with the required outreach and effectiveness. Then we also are looking at working with school teachers over a period of time to enable them to impart better school health program with a strong focus on health promotion and disease prevention. Then in certain parts of the Northeast, we are looking at also extensive cancer-related education so that cancer prevention can be done.
The initial duration of the project is for 2 years. This effort will be implemented in the first phase in 4 states of Arunachal Pradesh, Meghalaya, Mizoram and Assam. However, after successful demonstration of these efforts in phase 1, the activities will be scaled up to other states.
What we want to do is to look at those states where the health indices are not good. So Assam, Meghalaya and other states where we have a lot of cancer. So Mizoram, maybe Sikkim, and see what we can do there. Arunachal Pradesh, because the density is very low, so some segments will be neglected, and maybe have an assessment of the existing capacities people have and see what are the gap areas.
However, for better implementation of this project, the Public Health Foundation of India is more likely to first start working with the healthcare professionals who are already positioned in government health services and try to increase their management capacity through a variety of training programs.